It is Indiana in the Morning, always presented by First Commonwealth Bank, the voice of Indiana County, WCCS, 101.1 FM, AM 1160, and WCCSradio.com. Really, really happy to welcome into the studio with us this morning Dr. Seth Fox, who is an ophthalmologist now practicing out of the ambulatory center at the Indiana Regional Medical Center, and has been here since, when did you say, January?
Yeah, January 1st we started.
January 1st?
Yep.
Yeah. Well, be easy to mark his anniversary, won't it? Our visit this morning presented by Marcus & Mack, voted best law firm and best personal injury lawyer 3 years in a row in the Best of Indiana County contest. Visit them online at marcusandmack.com. Glad that you're with us here this morning. Good to meet you.
Yeah, great to meet you. Thanks for having me. I appreciate it.
You're a Ford City boy.
Yes, sir. Born and raised.
Yeah, nice. Still live there, or where do you live?
So I live in Murraysville now,
Oh, okay.
but still make it back. My parents still live there, so back in Ford City quite a bit.
Good community. Really, really, really nice there. All right, let's talk a little bit about what you do. An ophthalmologist, people might not even know what is the difference between optometrist and ophthalmologist. And I know you get that question a lot, don't you?
Yeah, sure do.
Yeah.
So ophthalmologists, they go to medical school, so they get medical training, and then they go into residency to specialize in eye surgery.
Mm-hmm. So eye surgery, we're talking cataracts, I would assume?
Yep, cataract surgery, do some glaucoma surgery, retinal detachment surgery. No, I don't do that, but yeah, anything with the eye. Lots of surgeries, different parts. Sometimes people think the eye can be pretty boring, but there's actually a lot of conditions and different things that can happen inside the eye.
Yeah, and taking care of your eyes is probably something that most of us neglect, isn't it?
It is. And so just like a lot of other things, we put it off, time passes by, but the American Academy of Ophthalmology, we recommend that you get an eye exam, dilated eye exam, starting at age 40.
Mm-hmm. Yeah, and dilated is important, isn't it?
It is important. It gives you a better view into the eye. So you think about looking through your pupil. So we dilate that pupil, make it larger so we can get a better view into the eye.
Mm-hmm. Mm-hmm. What are some of the conditions that you look for when you dilate the eye? You dilate that pupil, you take a look inside, and you get it's basically like a roadmap, isn't it?
Yeah, it is. Yeah. So we get a look at the natural lens. We look at the optic nerve, the health. That can indicate different conditions, so such as glaucoma. Glaucoma affects the optic nerve. There's also diabetes, hypertension, high blood pressure that can be shown in the eyes. We look at the blood vessels, look at the health of the eye. Macular degeneration is another condition that affects the retina, and so that's in behind the colored part of the eye, or the iris, so dilating that eye really helps view all those structures.
We hear about macular degeneration, and the commercials that you hear about it make it sound really, really scary. A very, very progressive type of thing that is going to eventually cause complete blindness. Tell me about macular degeneration. What really is it?
Sure. So the macula deals with our central vision, and that's a part of the retina or the camera film of the eye. So macular degeneration causes a thinning or degeneration of that part of the retina. So people then slowly, it is a typically slowly progressive disease. It affects the central vision, so they have difficulty maybe finding lines or words, but they can still see with their peripheral vision. Mm-hmm. And there's two different types. There's dry, or there's wet. So wet is when you get these blood vessels that can grow into the retina and then they bleed. Mm-hmm. And that's what the wet form is. And there's different treatments depending on what type that you have.
Yeah, yeah. You see, I'm looking at you now, and because you're an ophthalmologist and because we're talking about eyes, I keep wanting to fool around with the eyes because you think, oh no, I can't see all of a sudden. Tell me about those treatments that you do for macular degeneration. Is it as dire as it sounds?
So it's very patient dependent on how it progresses. There is sometimes a genetic component. Smoking is a risk factor for developing macular degeneration, so stopping smoking is very helpful, or never start in the first place.
Yeah.
Two different treatments. So dry macular degeneration is typically treated with eye vitamins. There's a certain specific eye vitamin called AREDS2 formulation that they've studied, and then the wet macular degeneration typically involves injections of medication inside the eye.
Mm-hmm. You also mentioned glaucoma, and we all get that puff test, and it kind of freaks us out because we know it's coming, and then and we think we're prepared for it. We never are. So you get that puff test. What does glaucoma measure, and what are the ramifications of not getting the best grades on your glaucoma test?
Sure. So that is a pressure test. We're measuring the pressure inside the eye. So glaucoma is a damage to the optic nerve in response to the pressure in the eye. Sometimes that's a high pressure, but sometimes you can still get glaucomatous damage even with a normal pressure in the eye. And so that's what we're measuring. We're measuring that eye pressure, making sure it's within the normal range, but also looking at the optic nerve, making sure it looks healthy as well.
And the treatments for glaucoma?
So there's different treatments for glaucoma. There's drops. There's laser procedures that you can do. There's microinvasive glaucoma surgeries. And then there's more invasive surgeries, which would be with a glaucoma specialist.
Cataracts. I had actually a guest in the studio last week who came in, and she was thrilled because she'd had cataracts removed from both of her eyes, and all of a sudden the world was clear again to her. And I've had others tell me as well that once those cataracts, they didn't realize that their vision had been affected because it was gradual.
Correct.
So cataracts. What causes cataracts?
So maturity. So everybody gets a cataract if we live long enough. There are some conditions or some ways we can try to slow the progression. So again, smoking can hasten the formation of cataracts. Diabetes can cause a particular type of cataract, and also UV exposure. So again, stopping smoking, controlling that diabetes, and also UV protective sunglasses and wide brim hats are always a good idea when you're outside.
Yeah. Okay. Well, that's a big one because we started by asking what are some of the ways that we can monitor, protect our eyes, and maybe avoid or at least put off some of these conditions that we suffer. So good sunglasses. And when we look at those sunglasses on the rack in the store, there usually is a sticker on them that gives you an idea of their ability to protect against UV rays.
Correct.
Am I phrasing that correctly?
Yeah. Yep. Absolutely. Yep. That's what you want to look for. You want to make sure they're blocking the UVA, UVB light.
UVA and UVB.
Yep.
Yeah. You want it to say both.
Yep.
Yeah. Do they do that by a number, by a percentage, or do they just say they protect against?
Yeah. Typically, I've just seen that they say that it protects against the UV.
What else should we be looking for in terms that you said a wide-brimmed hat is a great idea? Limiting what exposure you have to the sunshine, therefore, seems like it's a really good idea.
Correct. Yep. Limiting how much of that UV light is getting into the eye.
Yeah. And that examination that you mentioned, getting those regular eye exams, really important things.
Yep. It is. We can get an idea of, are you starting to develop cataracts or anything else that's going on inside the eye.
So we've mentioned really three really big ones: glaucoma, cataracts, macular degeneration. What are some of the other conditions that you would treat as an ophthalmologist?
So those are the three big ones. A lot of people talk about floaters, so we can look for any signs of retinal tears, retinal detachments. So that's that camera film. So real important that you get a good eye exam if you notice some new flashes, new floaters, because that can be very devastating to the eye.
Yeah. And so all of those are things that you treat, and I know that since you've been here since January, you've had a chance to maybe build up the practice a little bit. Tell me how it's been for you.
So it's been great. The community's been very welcoming, very similar to where I grew up. So I'm really happy to be back in a community like this, and it's been really a great pleasure.
Yeah. For folks that want to come and visit you, and is it something that they come to you only on referral, or is it something that they actually do as a regular bit of their routine,
Sure,
their healthcare routine?
So oftentimes it depends on what insurance type that you have. Some insurance companies do require a referral to come and see us. So the easiest way to figure out is call your insurance company. Some you can self-refer, and then you just call the office and we'll get you in.
The techniques that you use when you are performing eye surgery on someone, we have Dr. Clark in. We talk to Dr. Clark quite often about advances in robotic surgery, in the various different types of surgical procedures that they're able to do at IRMC. Is it that way in your line of work as well with ophthalmology? Is it an ever-advancing type of technology that enables you to get better and better and better at what you do?
So it is. So initially, cataract surgery, you started out with a large incision in the eye, and you took the lens out in one solid piece. So the cataract is a clouding of your natural lens that occurs over time. And so as things have advanced, we've gotten down to smaller and smaller incisions and technologies to break up that lens. So essentially, we use ultrasound that breaks up that lens into small little pieces, and we have a device that also has vacuum built in. So then the vacuum removes those pieces, and your natural lens is held in place by a lens capsule. So you get the new lens that you get, which everybody gets a prize. So you get a new lens inside the eye, and it goes inside that same lens capsule, and that's what holds your new lens in place.
Yeah. As those advances have come on, I bet you that's a pretty exciting thing for you when not only when you hear about something coming, but when you actually get to use it, put it into practice. I'm sure there's a learning curve, a training curve with you, but and you would never put something into practice that you aren't absolutely a pro at. But once you do that, I bet you it's pretty exciting.
Yeah, it is.
Yeah.
It's an exciting field. It's always advances, and to make a big difference in someone's life, and it's usually pretty remarkable. They start getting improvement in vision typically the very next day. Things can fluctuate out to a month, but yeah. And you're right. You alluded to people noticing how much colors are brighter and just how much they didn't realize how much they lost, because it is a gradual progression.
Yeah. But boy, when you get it back, when you get it back, it's a wonderful thing. Dr. Seth Fox has been our guest here this morning on Indiana in the Morning. People want to learn more about you, about what you do, and perhaps get set up with you should they have a concern. What should they do?
Yeah, so you can call the office, 724-463-4400. And then soon we're going to have a website up as well. And it's Fox Ophthalmology Associates, and you'll be able to find that online.
Beautiful, beautiful. Good to meet you.
Yeah, great meeting you. Thank you for having me.
Glad you came in to visit with us. It is Indiana in the Morning on WCCS 101.1 FM, AM 1160, WCCSradio.com. 24 and a half after 8, coming up, Boomer Sports, a couple of moments away. Matt from the WCCS Newsroom will take a look at sports as well. Mark Hilliard, Chamber of Commerce, at our next half hour. Walter Schroth will be joining us, Indiana Area School Board President. We'll talk about charter school funding formula in our 9:10 segment. It's Indiana in the Morning on WCCS, 101.1 FM, AM 1160, and WCCSradio.com.